Okie dokie, please. Good morning, everybody. I'd like to call this meeting of the Cook County Public Health Human Services Board to order on this Tuesday, June 18th at 8:37 a.m. On our consent agenda, we have a meeting agenda, minutes, financial report, abstracts and bills. There's the Minnesota Department of Health grant agreement for Youth Substance Misuse and Suicide Prevention Coalition. Approval of voluntary transfer of Merrisa Chapman from Children's Mental Health Case Manager to Developmental Disabilities / Community Access for Disability Inclusion Case Manager. Is there anything else to add to our consent agenda or remove and discuss? Yeah, Commissioner Johnson.
I would like to pull down item F, please.
Very good, thank you. Anything else? Hearing or saying none, I would entertain a motion here.
So moved.
Thank you, Commissioner Johnson. We have a motion. Is there support?
Support.
Thank you, Commissioner Sullivan. We have a motion and support. Any further discussion? Hearing or saying none, all in favor? Aye. Opposed? Motion passes unanimously. Thank you. Moving down to introduction of new staff. We have Paige here this morning. Good morning. And I'll hand over introductions to Martina and Allison.
I'll hand it right to Martina. So Paige is our new social services case aide. And she started on she kind of had a part-time start and then a full-time start on June 10th. So she's been here a little over a week. Mm-hmm. Did you want to say anything about yourself, Katie?
No, just I'm happy to be here. Some of you may recognize me from the YMCA if you're trying to figure that out. I recently came over from there or in Grey Trout. But yeah, I'm really happy to be here. Thank you.
Thanks for joining the team. We're lucky to have you. Any questions for Katie? All right. Thanks again, and we'll see you around. This moves us down to our staff report, and we can address item F for board action or before staff report, or what's your pleasure there, Commissioner Johnson?
Doesn't matter to me,
Okay.
I guess. Wherever it's most convenient.
Okay. Well, I think just as long as we have staff here, that we'll go along with the staff report, and then we'll follow up with item F for items of board action. So we have Andrea Tofte and Grinager here, and I'll hand the reins over to you guys.
Wonderful, thank you. So Andrea and myself are here this morning to talk a bit about emergency preparedness and summer emergency preparedness specifically. You've heard me specifically talk primarily about infectious disease response with the COVID pandemic, but reality is most of the time we are in preparedness mode and not in response mode, which means we're talking about how we can help our community be better prepared for potential emergencies. And what we had historically really focused on, and what we're focusing on again right now, is extreme weather events, so things like wildfire, winter storms, extreme weather in the summertime and wintertime, and then emergency preparedness also goes hand in hand with infectious disease control. So another piece is that we're going to be speaking about today is prevention of tick-borne diseases. And so it's a bit of a change, but this is kind of what non-pandemic preparedness work looks like. So it's really a pleasure to be speaking with you all about another aspect of our preparedness work within public health today. So Andrea is our Public Health Emergency Preparedness Coordinator within the department, and she focuses a fair amount of time on helping coordinate with Mike Keyport in emergency management, helping to bring together partners for our local emergency preparedness committee, working with the Minnesota Department of Health, and their infectious disease prevention and control unit, as well as their public health emergency preparedness unit, to make sure that we're getting all of the updates that we need from our state partners who really specialize in a variety of areas. So when we have questions, for example, about what is the historical trend for tick-borne diseases in Cook County, we connect with the Minnesota Department of Health. They do quite a bit of that more specialized work, and then we work with them so that we can make it relevant for Cook County. So I'm happy to be here today with Andrea, and I'm going to turn it over to her to get started with some information about wildfire season, which, while it's not a high-risk situation right now, is always a good idea to be prepared for what wildfire season can bring us in terms of health effects from smoke, and what we need to know in case there were to be a local wildfire with the need for something like evacuation. So without further ado, I'll turn it over to Andrea.
Chris, could I ask that the screen be shifted to focus on the presentation?
I will ask Melissa. I'm not
Okay,
quite sure how the new.
Don't worry about it. Yeah, well, it's pretty tiny.
Yeah, I'm not quite sure how the new technology works.
Just
It
like that.
duplicates that.
Oh, okay.
But on the YouTube, it's the full screen, so.
Oh, okay.
So we got that going for us, which is nice.
Can you switch to YouTube on this?
Please don't waste a lot of time on it. I thought it was a quick fix.
Yeah, I don't know. Sorry, Frank.
If you wanted to, you could pull up the YouTube on your computer as long as the sound was off, and then that could be the full screen of that.
We'll try that. Thank you.
Yeah.
You let me know when when you like me to start. Yeah.
Oh.
All right.
Sorry.
So there we go. So I'm gonna start with the wildfire preparedness. Wildfires are a natural hazard, and for Cook County, wildfires have been identified as a high-risk natural hazard. So wildfire preparedness involves a series of proactive measures that can be taken by individual communities and authorities to minimize the risk and impact that these can pose. So earlier this year, the USDA described the Superior National Forest as the most likely forest to experience wildfires in the eastern half of the U.S. And that was primarily because of the reduced snowfall that we experienced this past winter. So that raised concern on many of residents and local and state agencies. And they became actively strategizing and planning on how to effectively prepare for a high-risk fire season. So many requests came from community members and diverse organizations to learn more on how to prepare for the high-risk wildfire season. Commissioner Sullivan, along with Cook County Firewise, Minnesota Extension, Public Health, joined forces to bring educational sessions to different parts of our community to build their preparedness capabilities. So fortunately, the abundant rain that we have received this spring has helped to reduce the risk of wildfires. And the silver lining that we see from the high risk that we experienced for a little bit was that this brought preparedness in the forefront, and residents became adamant about learning on how to better be prepared in case we experience a local wildfire. So in the next slides, I'm gonna present to you the key information that we share with our community members in regards of preparation for wildfires. So the first thing that we need to know is understanding what type of alert systems we have in our county. And Code Red has been designated as the system to distribute alerts to notify about local events that might immediately impact our safety. And those include evacuation notices, but also Amber Alerts, public health crisis advisories, notifications of hazards of road conditions, for example. So we have emphasized in our learning sessions with the community the importance of signing up to this alert system that we have in place. You can sign up at the website, but also if there's someone that is not tech savvy or cannot sign up, if there were to be an evacuation order given, then our trusted partners, which are WTIP Radio, Boreal, and the county, would be the ones also passing down the information about the evacuation order. And along with that, our local volunteer fire departments would be going door to door to the area that is under evacuation to inform the residents in case they missed all the other alert systems. The next step that we explain or that we encourage our residents to know is like learn about their evacuation routes. And in this slide, you can see where is my house. I also, I obtained this image through the county website. They have a map and app gallery that this one specifically shows you the volunteer fire districts, but it also has the mapping capability, so you can see the different routes in the county and the routes that I can use to evacuate my little area where the star is. So what one of the things we recommend to our residents is to look at a map for roads for evacuation and then drive those roads so they can experience what those roads feel like and if there is potential for road closures. For example, my road has a private, part of it is private, and sometimes that neighbor closes that road. So then I need to be aware when that road is closed, so then I know exactly which is my only evacuation way out of the area where I live. So the next thing that we go through with our community is to talk about the being ready to evacuate. So if there were to be an evacuation order, then we will need to have the go bags ready and what needs to go in a go bag. Commissioner Sullivan has put together a very nice list of items that you can have in your go bags. If you were to have 2 vehicles, then they are very organized in 2 different lists, and that highlights the essentials that we need to have. Another resource that we have to look at this is at a federal government website named ready.gov, and in which you can find detailed information of how to prepare these go bags. Another thing that we talk with our community is very important to have a communication plan. So in this way, the household members, sometimes it could be that the disaster strikes when not all the household members are together. And so it's important that they know where are they gonna be able to reconnect in case they get separated. So for this purpose, you can find a form, so under ready.gov, or you can use that contact card from the American Red Cross. Those as part of your handout. Then so the other things that we highlight is like acknowledge and follow directions when you have to evacuate. So because Sometimes it could be that the evacuation order is given and that, let's say that someone doesn't want to leave their household. And that would be a little bit troublesome because our volunteer fire department will knock at their door and will talk to them until they evacuate. So it's very important for their safety and their safety of their loved ones that people follow the instructions of the evacuation order. What you see on the screen is another feature that is available under the Public Safety Map and App Gallery that you can find in our county website. And when you log into this app, you can either type your physical address or zoom in the map where you live. If there were to be an evacuation order or state, the area will be delimited with a color, and the color follows the FEMA Ready, Set, Go. It's a color coding in which ready means be prepared. So it's like you should have everything ready that you would need because you probably are at risk. The other one is be alert, so be more ready to hear the evacuation order. And the other red will be go, so evacuate now. And this one has a little yellow area in Hopeland. This was prepared by MIS team for the fire chief meeting that was held in Hopeland this year. And this is a new app, and we're encouraging our community members to go in there and explore the map gallery and see what different capabilities those maps have. So when an evacuation order is given, it is crucial to complete the evacuation registration form, because this is information that helps emergency responders account for all residents. This assures that authorities know that where people is, that they're safe, and that they're out of the area of risk. So in our sessions, we show them how to fill out the form, but also if there were to be on the Know Your Zone app, which you can see second to the right there, if your zone was marked as evacuate, then that will prompt this form in automatically. But also we just show them that you can find it in this safety, public safety map and app gallery. And one more thing that we talked about with our community is to take a moment to look at the wildfire sprinkler protection system survey and fill it out, see if you have a sprinkler system in your home and in what condition it is. This is very important because they are highly protective during wildfires, and this was clearly demonstrated with the Greenwood fire when aerial photographs were taken. The zones or the areas where there were wildfire sprinklers were notably less damaged by the fire. And one last thing that I would like to talk about is the wildfire smoke. And it's really important to understand that wildfire smoke exposure is detrimental to everyone's health. And so it's important to monitor the air quality. And for that, they have developed the Air Quality Index, which is calculated from PM 2.5, which is particulate material, at size of 2.5. And so they look at the concentration scale and convert from the raw pollutant concentrations, and then they translate that into into a digit that is easy to read, and then they color code the different states of the quality of the air. So when it's good, it's safe for everyone to be outside, but as the particulate material increases the density in the air, then we go from moderate to unhealthy for sensitive group to unhealthy for everyone to extremely unhealthy for everyone. And when we are at the very last 3, we encourage people into reducing their exposure to this poor air quality. And for that, we need to stay indoors and limit our time doing outside activities. When we are inside, limit pollution inside of the home, running your air conditioner or air purifiers where the air conditioning on recycle. And if you are unable to maintain good air quality inside of your home, go to a building, public building, or to a friend's house where you can reduce your exposure to poor air quality, and use an N95 mask, the ones that you have right there, in case you are unable to protect yourself with shelter and you are exposed to poor air quality. These N95s will protect you from experiencing the side effects of poor air quality, which include fatigue, headache, muscle aches, lung pain. And for people with underlying health conditions, it can send them to the ER. And then on the very last slide, and then sign up for air quality notifications. So you can either do that at the Minnesota Pollution Control Agency, or you can use the airnow.gov that will prompt when we have air quality alerts. Sometimes we experience smoke from wildfires, not from local fires, but from Canadian wildfires. So this is important for us to know when and how this could happen. Especially when we have one event, it's likely that the event would last more than one day, and that's when you want to go look and see what are the current conditions and decide whether you were gonna go fishing that day. Well, maybe if you still wanna go fishing, maybe think about bringing your mask or something, to not experience the health adverse effect. And then one last thing that we want to talk about and to prepare for wildfire preparedness is this: to know what you have in your home and what type of insurance, or look at your insurance. And for this, Grace is gonna take over.
So originally, this is an area where we collaborated with the extension, so with Sarah Waddle. They have a lot of really great information about preparedness as it relates to finances. And so one of the handouts in the packet that we gave all of you is example household inventory form. So this is a recommended step that, now would be a great time, for example, even though there's not an imminent risk of something like a wildfire. It's a great practice, and what it really means is you're going through your household and you're looking for things that you would want to claim if there were to be something like a fire or a flood, to get an idea of, and to document those things. So to write them down, to take photos of those things, and then to write down what the estimated value would be if you were to have to make an insurance claim because of property damage due to a disaster. It's also a great chance to see if your insurance coverage is adequate for what your personal possessions inside your household actually are. You could go through this exercise and realize, no, I'm underinsured. And when you read the fine print of something like your homeowner's insurance, or if you're renting, if you have renter's insurance, then you'll be able to tell, is this actually adequate? Would this actually cover what my needs would be if I were to lose personal property as a result of a disaster? I will say, homeowners insurance is one thing. People who are renting might not always think to get renter's insurance, but if you are living in a rental property and the rental property is damaged by a fire, for example, your personal possessions aren't going to be covered by the landlord's potential homeowner's insurance. You would want that coverage to be able to have some financial stability for recouping the cost of your personal possessions. So when you look online what they say to put on the inventory, there are places where they say put everything on there. To me, that feels a little bit unrealistic. I would say put things on a household inventory that you would actually want to claim. So things of higher value. It could be tools, furniture, appliances, things that are of a higher value that would be a challenge to replace in case you needed to replace. Maybe you don't need to put, the dishes from the garage sale or something like that, but anything that's of value that you would want to replace in case of an emergency. I'll also say, so flood insurance is not something that people in Cook County typically have. FEMA hasn't mapped the county for floods. It's not considered a major risk. However, there is an increased risk of flooding after a wildfire due to the changes in the vegetation level. So depending on where your property is, if it's right on a lake, for example, that might be something you want to look into. It might be challenging to obtain, but it is actually a risk, especially following a forest fire. So getting very familiar with your insurance coverage is maybe not the most glamorous step, but a very important step when it comes to preparedness. So it's not just that immediate, how do you evacuate? It's also bigger picture, what do I want to do to be ready? And that insurance coverage, it's not just what's in there, it's also what you need based on your inventory and really understanding the nitty gritty. What is fire damage even covered by your policy? Usually it is, but that's something to check just because you don't want the answer to be no and then to find yourself in need of that in the future. We're going to start switching gears a little bit to the area of tick-borne diseases. So I think this map on the upper left really illustrates something that a lot of us have noticed kind of anecdotally over the last 20-some years. As weather patterns have shifted throughout the state, the tick habitat and the rate of tick-borne diseases has also shifted. So what that graph is showing is the incidence of tick-borne disease by county. So if you look in the 1996 to 2000 state map on the extreme left, you'll see that our incidence is almost nothing. We didn't have almost any reported tick-borne diseases in the county. And as time has gone by, we have seen more and more. And even in the last, 2-3 years, those rates have really elevated. And that's not something you can, necessarily capture in a series of images that's based on a 5-year interval. But you see the whole Northeast region has become more and more experiencing a higher incidence of tick-borne diseases. And primarily those diseases, the most common ones that we see are Lyme disease and anaplasmosis. So those are both bacterial diseases. And you can see they're both passed by the black-legged or the deer tick. And you can also see kind of where in the U.S. the habitat for that deer tick is. It's really the eastern portion of the U.S. And then you see that little dot that kind of encapsulates the upper Midwest very, very neatly. So next slide. Let's see. Oops. There we go. All right. So then more about tick-borne disease. So the transmission time, it's not that you get a tick on you and you're just going to get a tick-borne disease. That's not at all what happens. So typically, it takes a period of time after an infected tick actually bites you to be able to transmit the disease, which is why preventative measures, especially those daily tick checks, are so important. So for those most common tick-borne diseases like Lyme's disease, anaplasmosis, it's between 12 hours and 48 hours typically for the pathogen to enter your body and be there to cause a disease. So what really you need to know is, and here's some more data on kind of what the tick-borne disease numbers looked like last year. And we know that these are undercounts, but these are people who have gone to the clinic, presented with symptoms of a tick-borne illness, and had the clinic report that disease to the Minnesota Department of Health. So that's where those numbers are coming from. And you can see Lyme's disease is the most common, and anaplasmosis is the second. In talking with our regional epidemiologist, this is a huge jump from even 2022. It basically doubled in a year. So it's something that we're keeping close tabs on as things change for us here in Cook County. You can see kind of that this is that graph on the lower left is basically showing statewide what that trend has been over that same time period from 1996 to 2023, and you see that increase in all of the most common tick-borne diseases throughout the state. All right, so a little bit more about Lyme disease and about anaplasmosis. So if you are bit by a tick that is a carrier for one of these bacteria, the symptoms will usually show up between 3 to 30 days. And the symptoms can be a fever, rash, muscle or joint pains, and fatigue. Lyme's disease usually presents with a rash that might not be painful or itchy, so it's not like, your mosquito bite or your black fly bite, but it's that characteristic kind of bullseye rash. And it could be like it is in the picture, or it could be a little bit more like blotchy. So the irritation that occurs on the skin after a tick bite is different, because if you get a mosquito bite or a black fly bite, it goes away rather than getting bigger. And so these rashes are typically quite a bit larger, and they're not just getting smaller over time in the same way. So it can be, over 2 inches in diameter that you're seeing a rash from a infected tick. So if the infection from a tick progresses undiagnosed and untreated, you might get pain and swelling in your joints. And it can become quite serious. So the most serious presentation would be like facial paralysis or extreme pain in major joints like your knee, for example. And the diagnosis is done in the clinic, so it's dependent on a recent history of exposure to ticks, compatible symptoms, and they can also do a lab test for these diseases. So the treatment option is antibiotics. So again, it's something that you need to go to the clinic to get a correct diagnosis, to get a correct prescription for the course of antibiotics that would need to be given to treat the disease. So in your packet, we also put some handy tools that we're distributing throughout the community on what to do to prevent tick-borne illness. So one is to know when you're at risk. So you would be at risk in knowing where ticks like to live. So in wooded or brushy areas with low-growing vegetation, places where there's that leaf litter on the ground. It kind of sounds like the woods, which is quite a bit of our county. Know when ticks are active. So the tick activity is greatest from April to July, and then from September to October. Really what we say is as soon as the snow cover is off the ground, it's tick season. So we have an extended tick season this year due to the lack of snow cover in the springtime. In your own property, you can manage areas where ticks live. If you have a well-kept lawn, if you're on a trail with not a lot of brush, if you've removed leaves from an area, if you have like a landscape barrier between your lawn and a wooded area, ticks don't like those kind of well-kept, like short grass. That's not their preferred habitat. They prefer leaf litter, low vegetation. They like to be more in kind of a moist environment. So other things that you can do are to create barriers between yourself and the tick. So you can use safe, effective tick repellent when you're spending time outside near where ticks live. So DEET-based repellents on skin or clothing. They're not for use on infants less than 2 months of age, but anyone else can use those DEET-based repellents. You can also pre-treat clothes with permethrin-based repellents, which you don't need to apply the permethrin to your skin. You put it on your clothes, and then you put your clothes on, and that'll also help. You can also use the dryer when you come back inside. So if you've been out hiking, ticks like that moist environment. They don't like the heat of a dryer, so that will kill them. If you put your clothes in the dryer for 10 minutes after you're coming back outside after a hike or gardening or, doing upkeep on your property, in a wooded area, you can just throw your clothes in the dryer, put some new clothes on, and that will also, if you have ticks crawling around on your clothes, that'll kill them. You want to check your pets and use tick prevention products in your pets. They also can be a lovely vector for ticks and other insects. And then tick checks. This is something that is one of those great, build it into your life, build it into your routine kind of things. So like I said before, it's not that a tick immediately touches you, you're going to get a tick-borne illness, not at all. If you build it into your life to do tick checks at the end of the day, that can go a long way in reducing the incidence of tick-borne disease and reducing your risk. So when you do a tick check once a day, what you're really looking at is you're looking very closely. If you look at that tick ID card, the ticks that we're most concerned about transmitting disease are very small. So I think of like the nymph stage is like a poppy seed, and then the adult stage is like a sesame seed. I mean, they're tiny, so you really want to look. You don't want to just kind of glance over. No, you want to really look for the ticks on your body, especially areas that are hard to see, such as groin or armpits. Another tip is to wear light-colored clothing. It's a lot easier to see a tick if you're wearing something that's not black or dark blue, because it's just easier for them to kind of blend right in. And then removing ticks. So what you want to do is either use your fingers or tweezers, and you want to reach close to the head of the tick, close to its mouth, and you want to just apply firm, constant pressure and pull them out, and then wash up with soap and water. So there's not really a lot of magic there, but that's the best practice for what to do if you find a tick on yourself. It probably doesn't rise to that same level of, emergency preparedness as wildfire, but it's probably the risk you're most likely to encounter enjoying life in Cook County in the summer. So it's a good thing to know about and to pass knowledge on to friends and family, so that hopefully that we can reduce that incidence of tick-borne disease even as the tick populations in the county grow. And that's all we have. So we're happy to take questions. We have lots of information in your packets. If you have questions, Andrea is our resident expert in the department, so I will direct you to her for more information. She's been great at working with partners to go and do proactive presentations in the community, and that's something that we're also open to doing. So if you have a community group that you know of or in your district and you'd like to have Andrea come and speak to them, that's something that we're also able to offer from within the department.
Thank you. Any questions? Yes, Frank.
Yeah, first, I think that's an excellent presentation. I would strongly encourage you to share it as widely as possible. Possibly even like the homeowners association meetings. A lot of them are coming up now. And I'm sure you'd be welcome to give a similar type presentation to one I know of is Gunflint Lake Homeowners Association, but I know Seagull and throughout the county. I'm sure that would be very valuable information. That's the comment I would like to make on that.
Thank you.
And I would just echo the fact that already we have a number of invitations, and I just want to thank you for the great presentation and the good work that you've done to really expand what we're able to share with the public.
Thanks.
Commissioner Sterling.
Thank you. Great, thank you for all the information. I had a tick 2 weeks ago, actually. Thought I was mowing my lawn and everything was covered, but nope, it got a little wedged in. So I have a couple questions. So Andrea, you mentioned that at the fireman training, which was in Hovland, there was a map put on the wall there. Are they at all the fire stations?
There is one map in that gallery that I show where I had, no, it's off. But there, when you go to the map area in the county website, it will prompt 5 different types of maps. One is the fire department, and it shows all the fire departments in the county, and they are delimited the area where that fire department covers. And the one that I showed in that person, like that they showed also on that meeting, was the Know Your Zone, and it had like a test in which they delimited that yellow area for like an evacuation zone. And they are working on updating the delimitations of those fire departments. They're like comparing that with the other type of data just to make sure that the limitations are correct.
So this information is basically online?
Yes.
Okay.
On our county website, yes.
Okay. So the other thought I have is all the VRBOs that are in our county. When you go into a home, do you know what to do in case of an emergency? So any thoughts on how an owner of a VRBO could help guide a guest who may have to evacuate, or have a little booklet or throwing binder, or just say, in case of an emergency, blah, blah, blah.
I think that's a great idea, and it's something that I can definitely work on. Try to reach out to the companies that I know, like Cascade Vacation Rentals, and try to like call out like through Visit Cook County as well, and then so they can have access to a handout that has this basic information, where to find more.
I'd like to follow up on that. That's an excellent idea. We tried an Airbnb last summer. We have a yurt in our property, and we tried an Airbnb. I've run Airbnbs in Florida for many years, and you have an excellent registration and licensing program here. I think it's a great idea to be in touch with the land use department or whatever it is that issues the license, and say, yeah, one of the requirements, along with this, and this, which they already have, you need to put a notice of emergency evacuation notice. What do you do? It's very simple to just post it in the unit, and I think that's a great idea.
For sure. I'll take that note of that.
And that, again, that's something that, for the board,
Yeah.
for the commissioners to consider.
Yeah, I think that's an excellent idea. And
The only reason I bring it up, I've had an experience with a couple of VRBOs of people calling me and saying simple things like, where do I mail a FedEx package? Or where do I find such and such? And it's like, this is really important, that they know
Yeah.
some
Yeah.
of the steps.
Definitely.
Allison, please.
If I may add on that note, we met last week with our Emergency Preparedness Committee and had a discussion around who are the partners that aren't at the table but should be here, and that was one of the parties or stakeholders that we acknowledged as the Visitors Bureau, and how can they help us to promote preparedness throughout the county.
Yeah, and I think it's a good idea to put it in the licensing too. We'll have to talk with him about that. Have
I had a
that.
couple other comments on the fire preparedness. I'm a member of the Gunflint Trail Volunteer Fire Department, and I just wanted to point out that during evacuation, we do visit every residence, every campsite personally, to make sure that there's nobody there. If there's nobody there, we leave a sign, a note, and if there are, we tell them they need to evacuate, whatever the level may be, that they're like, get out now, or in the next 12 hours, or be alert. So everybody places a visit. We do not start the sprinklers on their Firewise systems. So, time permitting, residents should start their Firewise and then get out. Or just get out, whatever, obviously, only if it's safe. But the fire department does not start the Firewise on a regular basis when we're doing evacuation drills.
Thank you. Any other questions, comments? Commissioner Sullivan?
One comment related to wildfire sprinklers is the form that property owners are to update regarding wildfire sprinklers does ask in there who is going to start your wildfire sprinkler system. If you're there, you start it, but if you are absent from your property, who is responsible for doing that? So that is something homeowners, property owners should fill out.
Thank you. All right, well, thank you, Grace and Andrea, and continue the good work, please. It never ends. But with your work, I feel confident that our community is safer and more informed, and we'll just keep building off of that, so thank you.
Thank you.
Let's see here. This moves us down to our director's report. Director McIntyre.
Thank you. Good morning. And
Morning.
thank you, Grace and Andrea, for your excellent presentation. I think this is a really strong example of how our capabilities have increased in recent years as we've added staff within our public health team to really prioritize prevention, community outreach, partnership. So grateful to both of you for your work in that area. Thank you. Staff updates. As always, I have an org chart in the board materials for you all to get a snapshot of where we're at with filling vacant positions. You met Katie this morning, our recently hired social services case aide. Katie started in her training part-time on the 3rd of June and has been with us full-time since last Monday, the 10th. As Katie mentioned this morning, she comes to us with a strong background, both in administrative and direct service work through her role as the Youth Development Coordinator with the Cook County YMCA. So really grateful to have our front office team fully staffed for the first time in about 9 months. It's been a really long time that we've been down team members on that staff. It's such a critical part of our department as that really gateway from the public to our staff throughout the team. So really glad to be fully staffed in our support staff team. Also very excited to bring on board Margaret Johnson as an eligibility specialist later this month. She begins on Thursday, the 20th. Margaret comes to us from the Sawtooth Mountain Clinic, where she served as their patient access coordinator and MNsure navigator. So Margaret brings a really unique level of subject matter expertise within the METS, or the Minnesota Eligibility Technology System, or MNsure system. So really glad to have Margaret coming on board. She will start with SNAP training and healthcare training, which will provide some critical support to that team who is still very new. On that, I wanted to mention that we have brought on Ellis Walsh, a temporary employee, as a temporary employee for the short term while we're filling that position and continuing to train the team. Ellis left earlier this spring and was the only team member besides Dagmara, our supervisor, who's trained in family cash programs. Dagmara is currently the only team member who's trained in long-term care programs, so we're really still, even though we're fully staffed within that team, at a deficit because of the lack of depth of programmatic knowledge within that team, and that our supervisor is really the only one holding that knowledge right now. So grateful for Ellis providing that very temporary part-time support through the summer. On items for board action today, pulled from the consent agenda was the transfer of Merrisa Chapman from Children's Mental Health to Developmental Disabilities Case Manager. I'm happy to give a quick overview of that transition and can address any questions that the board has before acting on that request. Merrisa applied for the position that was vacated earlier this spring when Julie Kinney resigned from her position with the department. Merrisa applied and was the most qualified applicant for that position. Merrisa is very experienced, a licensed social worker, and will really bring a lot of strength to that position, that population. There will be a significant overlap in the families and youth that she's working with due to some of the overlap in case management services with children's mental health and that developmental disabilities and community access for disability inclusion role. Any other questions about the transfer on the items for board action today that I can address?
Yeah, actually, I was just concerned because we just got that team fully staffed and, well, except for the crisis response worker. And the turnover has been a lot since I joined this board. So I went and I just Googled, what's turnover rates? Well, we're right on track for this kind of position, but then I went and started looking up the SAMHSA report. I wrote down what it was called. Anyway, it was public sector positions have the highest turnover rate. And there's this long report on the SAMHSA website of what you can do to solve that. I did not make it through all of that last night, many chapters there. But I'm wondering, what are we doing? Because I understand stress. I don't know the reason Merrisa decided maybe it wasn't a good fit for her. I understand that transfer, but I just want to make sure, because that is so much turnover there in this job, that we are aware of the supports that in place that are needed to make sure we have more long-term stability in those positions, and wondering what we are doing to ensure that. And how are we making sure that the clients that have, like, every year or year and a half have somebody new to deal with, how are we supporting those clients and how are we supporting the work staff?
Thank you for your question, Commissioner Johnson. I'm happy to provide a few concrete examples of how we're working to address turnover. And within children's mental health specifically, one of the greatest investments in staff retention and in stability for that caseload is by adding that second children's mental health case manager position. That is able to provide a lot more stability for the team and continuity of care when we do have transitions. I would argue, too, that a person moving within the department is an asset, in that we're able to bring their knowledge, skills, and expertise to a new role within the department and have that carryover, not lose them from the agency completely, but have them working within a new scope and with, in this case, some of the same population, but a new caseload as well. I think our wage study made a meaningful difference in some of the turnover in terms of what we were hearing from staff about their ability to find positions within the field that have less stress, less visibility in a small community, able to work fully remote for a health plan or a state agency for higher pay. I think we are much more competitive than we were a few years ago because of the adoption of the wage study. Within our leadership team, we are working on some projects around structured supervision. How can we ensure that we have some continuity across all teams in our weekly check-ins so that we're giving staff the space to be able to go talk through their concerns, debrief stressful situations. Almost all of our supervisors are doing that presently, but we're looking at some more structured tools that we can use to bring consistency to that process. Stay interviews are another example of how we're having conversations with staff in a preventative lens before they've made the decision to leave the department, to ask them what's going well with your job, what isn't going well, how likely are you to leave your position, what can I do, what's in my power as your supervisor to prevent you from leaving your job, and how can we work together to create a structured plan that puts some accountability behind those factors that are within our control.
Okay. And I'm just thinking back, like I said, it was a long report and I didn't make it through, but some of the things that stuck out to me was peer support was very influential, flexible scheduling, and there was a third thing that, no, I can't remember. But I just thought, oh, I wonder, I don't know what we're doing here for those kinds of things that in that study said, proved or suggested that help people stay in their positions longer. So, and I went back to look to see about caseloads, and the last information I had, I think, was from 2021 when Jaden Cooper did a presentation when I was first on the board. So I'm wondering, now that we have Al Kunsley, I'm just wondering, is he taking over all of the caseloads then? Or how, just want to make sure we don't overburden a different position because we have another vacancy. What are we doing to support Al?
Yeah, so we are very much in that transition planning phase right now with Merrisa, Al, John, and Martina. Marissa's new supervisor talking about that transition. What will that look like? We're targeting early July to be able to have a planful and gradual as possible transition for Marissa's very complex caseload. So Al will be taking on some of those cases. John, as the supervisor, will be providing a great deal of support for some of the more complex families that Marissa is working with, or families with higher needs, higher need for ongoing engagement and frequency of contact. So we are very much in that phase right now of planning the transition to minimize impact on individuals and families and other staff within the work team as well.
Good. Thank you.
Any other questions on this item?
Do we need to approve it now since it was removed from the?
We most certainly, yes.
Move that we approve the transmission.
Thank you, Rana. We have a motion. Is there support?
Support?
Thank you, Commissioner Sullivan. We have a motion and support. Any further discussion there? Thank you for the questions and clarification there, response. All those in favor? Aye. Opposed? Motion passes unanimously. Thank you.
Continuing on with staff updates, we continue to recruit for in-home support coordinator following the transfer of Laura Nelson from that in-home support coordinator role to adult services care coordinator. We have interviews this week. We are also interviewing for coordinated crisis response with a number of new candidates referred for that position as well. We'll be interviewing next week. And then we are recruiting for children's mental health to backfill for Merrisa's transfer internally to the Developmental Disabilities and CADI case manager. We are also recruiting for the public health educator. That's the new grant-funded youth suicide and substance misuse prevention coordinator. So both the children's mental health and public health educator are open for recruitment on the county website. Moving on to agency updates. In the financial report, I'll call your attention to a few items, both in children and family services and in out-of-home placement. We are slightly higher than projected, but those expenses, as I reported last month, are trending down from the first few months of the year. So we don't expect to be considerably over budget in those items, barring any other changes in need. The financial report does include the first tax distribution for the year, and all other expenditures and revenues are mostly in line for what we would expect to see at this point. Wanted to share follow-up from questions that were raised last month within the 2023 year-end financial presentation regarding child support caseload trends. I was able to connect with Dan Plinsky, who is the child support and collections supervisor with Carleton County. He gave a very extensive explanation for what might be driving those changes, so I have some notes from that here. Dan reports that caseload numbers are declining throughout the state. Dan serves on a child support advisory board, which is a statewide advisory group, and that they often discuss the statewide trends in decrease in support referrals. He referenced a statewide campaign to increase outreach in 2023 for those cases that aren't required to be referred for support and collections, but those voluntary requests or private requests for support and collections. Another issue that the advisory committee identified, or maybe not issue, but driver that might be impacting this change, is that parents can more easily pay each other through Venmo, PayPal, or other services, so may not need that assistance from the state agency to facilitate that. Statewide, there were 206,671 cases open in 2019. And 179,062 cases open in 2023. So that represents a 13.36% drop over that same time frame that was referenced in the presentation, that 5-year. So it's definitely not just a Cook County issue. Dan also asked if perhaps a change in the population or declining birth rates locally could also be influencing that change. Dan also added, quantitatively, our caseload is dropping, but my opinion, qualitatively, the child support jobs have become more difficult than ever with even fewer cases. For a few examples, we now have to e-file our own court documents. We now have to contact families to do intricate safety searches on cases going to court. We have 11 different reasons we need to look at before determining to suspend a driver's license, etc. So that complexity is increasing despite the decrease in caseloads. Another significant change based on direction from the federal government, we no longer enforce 4E foster care cases except in extremely rare circumstances. So all of those cases have been removed from PRISM, which is the state system in which child support collection is determined. Dan said, I don't have the total count of how many cases this was, but it was more than just a handful. These were some of the lowest paying cases. Even though this was a drop due to case numbers, it should be an increase in our collections percentage. Dan also said he would be very happy to come back before this board before the end of the year to present on some of these trends and the work of the Carleton County Support and Collections on behalf of Cook County families.
I think that'd be really nice, but I don't know when exactly.
Okay. Well, we'll get that on the books.
Thank you.
Wanted to let you know in advance of next week's regular Board of Commissioner meetings that we anticipate having a grant agreement and subcontract with Care Partners for the next phase of our Age-Friendly Communities grant program. And a reminder, this was also noticed on the agenda of our event coming up next Tuesday at the Art Colony on Studio 61 to be formally recognized as a county and community for entering the Age-Friendly Network. And that, again, is in partnership with Care Partners.
It's going to conflict with our board meeting, but I'm hoping to bop down there and we'll just see what's on, where things line out timing-wise. But I got the invite from Grace. Thank you.
The last topic under agency updates is an overview of the request under items for board action to designate signatory authority and formalize our intent to enter Phase 2 of the Minnesota Department of Transportation Moving Greater Minnesota Forward grant. So Martina Johnson is here to be able to answer any questions that you all might have about what this Phase 2 project means beyond the additional funding and technical assistance from the Department of Transportation.
Any questions? Come on up, Martina, if you would, please. Morning.
Morning.
You have some questions?
Right, yes, I do, thank you.
Mr. Johnson?
Okay.
Thank you. So this grant, about $4,000 or so, and is this used to like pay the gas and the license and the, so does it run through our maintenance department then as fleet services, or how does this get administered?
Yeah, so this is in conjunction with our Boreal Partners Transit project that we already started. We got a Live Well at Home grant to fund that project and purchase a ADA compliant van. That was awarded to us in November of last year, and we purchased the van in, I think it was January or maybe early February. And so this is just a continuation of funding that project. So we did have everything set up through maintenance. Our van is considered part of the county fleet and is insured under the MCIT program or insurance.
Okay, and that's, this is more a bookkeeping question, I guess, as far as increasing the maintenance department budget because of those costs being run through that department. I'm just wondering how the transfer goes as far as this grant being in the PHHS budget, but the expenses coming out of the general fund budget. I'm just, how does that get reconciled? General entries, or?
That's probably a question for Brady, who's not here. I'm not sure why we're talking about this process. But anyway.
Well, I'm just wondering how this is another one of my questions about how does grant funding get tracked? I just want to understand, we're getting $4,000, and how does the department track where that gets spent?
You want me to
What line
answer?
item?
Considerable reporting to the state agency is required by the terms of each individual grant. We're reporting on how those funds are allocated within our budget. I believe our original grant request, correct me if I'm wrong, Martina, but had funding to offset the expense of Molly's time, for example, for providing legal guidance as it relates to some of the liability concerns around having a shared vehicle program. I don't believe that we had funds for Brady's time in the budget.
No, and actually Molly's time is in kind. We had to have a match portion that was in kind. But the way I understand it is that the maintenance department would bill us for any gas that we use under the program. They have a tracking sheet in every vehicle, and so they know which agency to bill for the gas, and they do that. I don't know on what, like if it's monthly.
Okay, that was what I was trying to get at. So it does get run through the fleet program, so it would be a general entry thing that comes about. So I just want to make sure we're covering the costs and we understand what the costs are when we apply for a grant. And this is a bigger issue, but that when we do receive grants, regardless of which department is, that we're tracking the expenses for that grant as a local, not at the state level, but at the local level. So, thank you.
No other questions?
No.
All right. Any other questions from anyone on this item for board action here? Else I'd entertain a motion. Commissioner Sullivan, you'd like to speak?
I would. I'd like to request that the PHHS Board approve the resolution participation in Signatory Authority for MnDOT's Moving Greater Minnesota Forward program.
Second.
We have a motion and support. Further discussion? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes unanimously. Thank you. And now we're down to our committee reports. Unless you have, is there any other? No, okay. First one is the Active Living Steering Committee, Commissioner White.
The big thing that I learned about that needs to be shared is that there are free bicycles to be had, being dispensed through the Congregational Church. People can donate any size bicycles, and I believe they said it was Jeff Kern who gets them up and running, and they are free for everybody, all ages and sizes, children to our to adults in the community who want one. So that was pretty fun. And I do not know, they didn't give a time or when you could pick them up or something, but it's at the Congo Church. You want me to go down my whole list of things, committees?
Well, I mean,
You'll do it one at a time.
Yeah, I mean, the next, if you're through with the Active Living Steering Committee, the next one would be the Arrowhead Economic Opportunity Agency, or AEOA.
And that meets tomorrow in
Okay.
Duluth.
Okay. And then next we have the Arrowhead Health Alliance.
And that one was just last week. They are going to be copywriting the Yellow Leaf name in Minnesota. That was a big discussion, but it will be in Minnesota, not nationwide. It was a cost consideration for legal things. And then the bylaws, the other big thing was that if I understood this, the state and the feds, it gives its monies, $7 million. And they changed or set it in stone in their bylaws that the Arrowhead Behavioral Health Initiative, which includes 6 counties and 3 reservations, they approved the bylaws, and that then, I lost track. I didn't understand the whole thing. The Department of Health approved, it's called a crisis grant. Are you aware of that?
This would be the Department of Human Services.
Oh, Human Services, okay. So that grant application has changed, and it's now, those funds come through Lake County. I still need to learn more about this. I'm just parroting
Sure.
chunks that I brought out, so if,
It's complicated, for sure.
so there was that.
Thank you. Next, we have the Arrowhead Regional Corrections, ARC, Commissioner Johnson.
Yeah, last month, we had an excellent presentation on Arrowhead Juvenile Corrections and the statistics and the work that's been happening there. The next meeting is Friday in Duluth.
Thank you. Next, we have the Child Care Solutions Subcommittee, Commissioner Storley.
We will meet next month.
Thank you. Community Health Board, I did not attend. I was all set to attend virtually, and that didn't work out. But I wonder if, Frank, if you were able to attend, or if you were virtual, or
Yeah,
do you have
I
any
did,
notes? Sorry to put you on the spot there.
No, that's okay. I did attend virtually, and the, sorry, give me a few minutes and I'll.
Oh, yeah, this is on me, Frank. No, and not you at all. We'll move on to the Cook County Local Advisory Council for Children's and Adult Mental Health. Raina.
I wasn't able to attend, I was out of town, so.
Okay. Anything pertinent that, or?
I'd be happy to give an overview, otherwise Commissioner Sullivan was present
Oh.
at the meeting as well. But rather than put you on the spot, I'll get started, and then if
All
I
right.
forget anything, let me know.
Okay.
Go team.
The bulk of our agenda was filled with a presentation from Molly and myself on our site visit to Yavapai County, Arizona. So we shared about that NACO-sponsored event, how Molly came to be invited to participate, our goal to have Judge Hankey be a part of that as well. Unfortunately, that didn't work out, but Molly and I still were able to learn a lot about Yavapai County and some of their initiatives around justice and behavioral health, and how the sheriff's office, public defenders, county attorney, and what we found was a pretty robust mental health system in Arizona are able to partner and really divert individuals from the criminal justice system through coordinated crisis response, through diversion programs, through really strong partnerships and coalitions, and some even legislative action to dedicate funding to some of these partnerships. There was also discussion about their pretrial diversion and competency restoration programs, and Molly and I were able to share a little bit about what we think we could bring back to Cook County, what's similar, what's different, what are some of the resource considerations in terms of our ability to increase preventative services for these individuals.
Please, Commissioner Sullivan.
I'd just like to add, the reason this particular county in Arizona was selected is it's very similar to Cook County, although the population is larger. It is very remote, it's geographically large, and so there were a lot of parallels. And I just want to commend both Attorney Hicken and Allison for doing a great job with the presentation, and would recommend you share those slides with this group. There's so much valuable content.
Yeah, I feel like, not knowing anything about that county in particular, I feel like it's largely in Arizona, like a state thing, and then the county is able to work within whatever the state had prioritized, is my guess, but I am really curious about the whole shebang, so.
Yeah, that was one of our key findings, is how minimal the role of county social services was in this partnership. It was really led by the sheriff's office with their behavioral health director as the head of this initiative.
Mm-hmm.
There's also 2 major health systems in Arizona providing comprehensive mental health services, from crisis response to crisis stabilization, and those are resources we just don't have here in
Sure.
Minnesota, especially in Cook County.
Yeah. Thank you. Restorative Justice, Commissioner Johnson.
That one's tomorrow, and we are in the process of hiring a new case manager, and hopefully that will be announced soon.
Thank you. Council on Aging, Commissioner White.
They are having a pancake breakfast this coming Saturday from 8 until 11 o'clock. It's another fundraiser for them. The building continues to be used by many people in the community. And the biggest thing that particularly the cook was excited about was, after a very hot, humid, and unbearably time in the kitchen last year, they finally got the hood fan because somebody volunteered and fixed it. They had been waiting for all this time for someone to pay somebody to do it, and somebody just came forward and just fixed it. So, feels very nice in there now.
Well, good. Thank you. Emergency Preparedness Committee, Commissioner Sullivan.
Well, I think that both Grace and Andrea shared all the information that is really critical to us right now. The one thing I would add is that at our meeting, we did discuss increasing the number of tabletop activities that we do for a variety of situations, just so that we are more prepared.
Thank you. Healthcare Planning Committee, Commissioner Storley.
I wasn't able to attend. Were you able to, Allison?
I was. Let me look at my
Any
notes.
highlights there?
I have my notes on what I reported. It's not very helpful. We'll repeat. It was light attendance at
Yeah,
our meeting.
right.
We mostly gave staffing and programmatic updates from each of the healthcare and service partners in person.
We'll meet again in August.
Okay, thank you. We have National Association of Counties, NACO. Commissioner Storley,
Okay.
anything there?
Well, this child care conference in Arizona was a prime example of the support from NACO. You know, they are just on top of all issues in our country because we go to the meetings and we bring things up, or we support somebody in Georgia or California or whatever. One of the issues right now that we've been discussing is for Medicaid to support more psychotic places for people to go, people who are suffering from psychotic events, and for the follow-up for the money to be able to support them when they go to a facility, which also is a question mark about where do you go in some of the states. And so mental health is an ongoing item that we talk about. We're going to meet the first week of July in preparation for the summer NACO meeting, which is in Miami, Florida, in the middle of July. I have not signed up to go because they're already flooded out. And who wants to be there in humidity? I'll sign up for another place to go. So I'll have further discussion on some of the issues I'll be talking about there, and then I'll get a report from that when it's over.
Okay, thank you. Northeast Minnesota Office of Job Training Program, Commissioner Hawkins, or Johnson, pardon me.
Well, let's see. There's been some policy work. That meeting is a week from tomorrow, I believe in Carlton. And I'm just going to mention, again, I've been on this now. I took over from you. And I have appreciated getting to know the other commissioners from the other districts. And I think the organization is doing some good work with their offices and job training, but I do question what Cook County's doing sitting at the table. We don't have big, large businesses and we're talking about the staffing at these different offices in Virginia and Hibbing and International Falls, which I try to give my input, but and I'm just going to throw it out there again that I'm sure there was a very good reason why Cook County joined this joint powers years ago, but I do question what Cook County's getting out of it personally, because we already use AEOA for our job training through MFIB, and that's what the majority of the other counties are talking about and how they're using their monies. And I'm just like, I don't have it. So any advice, or maybe we want to have a different discussion about roles of the county commissioner, and I'll look at our joint powers agreements and who we are, which ones we're part of and why we're there, and just make sure it's the best, most effective use of our commissioner time. So, but I do appreciate the other commissioners and hearing what's going on in their counties, but I question how I am effective sitting in their meetings telling them how to run their job training programs. So,
Mr. Chair.
Oh, Commissioner
I
Storley.
did go to one of the meetings, and I agree with you. Maybe it's something that we need to look at in January when we review all of our commissions and boards, and maybe the rest of the year. If you want me to go and fill in again for you, I'd be glad to, so we kind of have a real feel and talk about joint powers for sure, because it's, it's great sitting there and meeting all the people and understanding what's going on in the range, but it's just not really our way that we can have much input to help them.
Yeah, my time there I had similar experiences. I always enjoyed sharing what's going on in Cook County and where we were coming from. wouldn't be surprised if it was a year lag between Cook County talking about short-term rentals and housing to the rest of the region talking about it. And at the time, they're just kind of like, yeah, whatever. And then as things progress, they're like, oh, wait, you guys have been working on that? And so it's not always what we get, but what we can also contribute. And so trying to shine a light on some of the things that we see coming, I think is really helpful for our region. But before we, in my opinion, before we, and this isn't the Public Health and Human Services Board's purview, but before we as the county board talk about that, I think it might be worthwhile to talk about it as a joint powers. Why, at that board meeting, why are we here? Why is Cook County here? What are all the other counties getting from us or giving to this? And then, when you're talking within that framework of the joint powers agreement, and all entities of the joint powers agreement are, have talked through that, and then said, yeah, actually, Cook County, what are you doing here? Then it would be like, okay, let's talk about that as a board. But I feel like it's we're really lacking perspective on that, right? And so to talk about it as a joint powers board, I think would help flesh that out quite a bit.
And I agree. There's benefits to that, and one of the ones that I can think of is just keeping our connection with the other counties that are in the Taconite district, because there are some that think Cook County should be out of that district. And I would advocate we don't want to be. We should be supporting the economy of the entire northeast Minnesota. And so I see that connection, but I just think as a board, we should have the discussion. What do we want? What's the focus? So that there's a unified front that, yes, we think this is important because of, I went in thinking it was to get job training, and I realized that's probably not the main focus for Cook County.
Right.
And so I'm struggling with that, and I'm looking for direction from my fellow commissioners.
I guess looking back to it at those meetings, so a lot of what I got was from the other commissioners and getting regional updates and all that. But I'm trying to think of another board or committee where I mean, EDA, I guess, certainly for us locally here, but just getting that more regional deed connection. Like, I feel like that's where some of those conversations happen. And so I really appreciated that. That's where I think got a lot out of those meetings, but that's, few and far between. I guess they don't meet all that often anyways, but I'm just trying to rack my brains of other things where, but you're right, as far as the actual job training, AEOA covers the services quite well for our county. It's more of just kind of being a team player with the rest of it. But I'm open to all things, tell you what. Thank you. Is there any, I guess that's probably the end of that.
I just wanted to raise that issue.
Yeah. North Shore Collaborative have not met. And Public Health Human Services Advisory Council. Frank?
Also did not meet in June, but there's a couple of things I'd like to put on the radar for upcoming meetings. First of all, the combination of vaping and CBD cannabis legalization, something people may not be aware of. If you take CBD oil and you vape it, it forms mustard gas in your lungs. Really, a real bad problem. And I think that, to what extent you say, well, don't do this, don't put beans in your ears. And then kids are going to put beans in their ears. But just to be aware of that. And the second thing is the nationwide surge in colorectal cancer at younger ages, and the resulting change in the guidelines to start colorectal screening at age 45 instead of age 50. And other than that, I did want to mention, if I can talk for just briefly on the Community Health Board. So the first thing, and Grace, I think you were part of this conversation, tweaks, alterations to the mission and value statement that went on with the Community Health Board, just focusing a little bit more. I think the biggest news was that the four-county area was awarded a grant application for round 2 of the Minnesota Department of Health Infrastructure Program. And that grant cycle begins July 1st. And right after, on July 2nd, they have their work planning session for the use of those funds. And the focus on that has been communication, and we've already seen part of the result of that with Jenna's work here locally, as well as throughout the region.
Great.
That's what I got.
Thank you. Let's see, brings us down to, for the good of the order, anything, anyone, yes, Allison, please.
A couple things I've neglected to include in my report and want to draw attention to on the agenda as well. The first being our August 6th special board meeting for the presentation of the 2025 Public Health and Human Services preliminary budget. I also want to remind you all that our Public Health Fund request for proposals is open through next Friday, June 28th. At which point that subcommittee of our Public Health and Human Services Advisory Council will be reviewing the applications coming in from local nonprofits or individuals who are aligning with a 501c3 to promote a new program or service locally. And we anticipate presenting our funding recommendations shortly after our budget presentation in August. So most likely at our August regular Public Health and Human Services Board meeting is where you will see those recommended allocation of those grant dollars to local organizations. And I also wanted to mention that we had staff representing the department at both the Grand Portage Health Fair and the Pride events over the weekend. We had 4 staff representing our behavioral health team, economic assistance, public health. At Grand Portage Health Fair, we distributed 4 large boxes of helmets at the health fair, which was great. I'm looking to get an exact number on what we distributed so that we can get some information out publicly on that. At Pride, we also had 4 staff representing behavioral health and public health teams, and distributed several naloxone kits, some other outreach materials, and just had a great community engagement at both events. Also, we advertised our 2 vacancies with the department at both health fairs, and that was a lesson learned for me, that this is a great opportunity to connect with people in a different way about job opportunities with the department, even if it isn't for those immediate job postings, but for future development of local folks who might be interested in working with the county.
Smart.
Yeah.
Thank you. Anything else for the good of the order? That moves us on to the future meetings. We have the June 25th at 10 a.m. Age-Friendly Communities Reception at the Art Colony Studio 21. I doubt we'll have a quorum there. I think at 10 a.m. we'll still be in the thick of it. But I am hoping to be able to duck out for that, and then I'll duck back. And then also August 6th, as Allison just mentioned, a special meeting at 8:30 a.m. for the preliminary budget presentation. I will not be here, I'm afraid, so ask for our fearless vice chair to take over there. And that brings us down to item 9, adjournment. We are adjourned. Thank you, everyone.
Thank you.
Thank you.